Good day everyone, I'm Charlene Mae Blance, your student nurse from Naga College Foundation. So for today's video, I'm going to assess the neurological. But before that, let me gather all the needed materials and perform the hand hygiene. Hello ma'am, good morning. I'm Charlene Mae Blance, your student nurse from Naga College Foundation. For verification po, let me know your name. How about your birthday po?
November 15, 2000.
Ilang taon na po kayo, ma'am?
9.
Okay po, so today I will be assessing your mental status, your cranial nerves, your reflexes, your sensory function. Is that okay with you, ma'am? So in order to do that, I will be needing your cooperation on parabolic accuracy and assessment. Is that okay with you, ma'am? Okay po. So, but before that, I'm going to assess the orientation and level of consciousness. So, ma'am, alam niyo po ba kung nasan po kayo ngayon? Okay po. Can you state po yung time, date, and kung anong araw po ngayon?
8 a.m. June 15, 2022.
Okay po. Alam niyo po ba kung saan kayo nakatera? Okay po. May mga times po ba na hirap kayong maalala yung mga nangyari sa paligid niyo? Okay po. Ma'am, can you repeat po yung sasabihin ko? 743, 743.
743.
Next naman po, 74357.
74357.
Ngayon naman po, repeat nyo yung sasabihin ko pero backwards naman po. 743.
347.
Kanina po ma'am, may mga sinabi akong information sa inyo bago po yung interview. So ma'am, naaalala nyo pa po ba? Pwede nyo po bang sabihin sa akin ngayon? Ilan po yung temperature natin kanina?
36.2.
How about yung BP nyo po?
120/80.
Yung weight po?
20 kilos.
So, okay po. Naaalala nyo po ba, ma'am, yung mga ginawa nyo kanina bago kayo pumunta dito? So, that's good po. So, next is assess the patient's attention span and calculate. So, ma'am, may mga sakit po ba kayo or nag-under ng surgery 5 years ago? Okay po. Ma'am, can you please recite me the alphabet?
A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P, Q, R, S, T, U, P, W, X, Y, and Z.
Okay po, thank you. Ma'am, can you please subtract for me the 7 minus 3?
4.
Okay po, thank you. So, next, I'm going to perform the cranial nerves, which is the olfactory. So ngayon naman po, ma'am, pwede po bang suminga po kayo? Then, takpan nyo po yung isang ilong nyo, then ipikit nyo po yung mata nyo. Then, may ipapaamoy ako sa inyo. After that po, sabihin nyo po sa akin kung ano yung pinaamoy ko sa inyo. Okay, close your eyes po, ma'am. Okay. Ma'am, use this po, pang cover po ng eye nyo. Tapos sabihin nyo po na yes kapag nakita nyo na po ito sa peripheral view nyo po. So, can you please cover your right eye po, ma'am?
Yes.
Can you cover yung left eye naman po?
Yes. 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 Yes.
Next, I'm going to ask the client to read the books or magazines to assess nerve vision. So, ngayon naman po, ma'am, can you read this sentence po?
So, upon percussion, timpani sounds are heard in all four quadrants, which is a normal finding. So this indicates that the air in the inside are rising. So this is a normal finding.
So, okay po. Next, I'm going to assess the visual fields of each eye for confrontation. Next, I'm going to perform the cranial nerve 2, which is the optic. I'm going to use the Snellen chart to assess the vision or eyesight. So next, I'm going to perform the cranial nerves, which is olfactory. So ma'am, pwede po bang suminga po kayo? Then, takpan nyo po yung isa nyong ilong. Then, close your eyes po. Then, after that, may ipapaamoy po ako sa inyo, which is, kailangan nyo pong hulaan. So, here po. What is this po? Okay po. Sa kabila naman po. Okay po, thank you. Open your eyes, ma'am. So, next po is the cranial nerve number 3, which is oculomotor, cranial nerve 4, which is trochlear, and cranial number 5, which is the abducens. So, I'm going to inspect the margins of eyelids of each eye. The assess of extra oculomotor movements. So, okay po. Next po ma'am, sundin nyo lang po kung saan yung direction ng pen light nang hindi gumagalaw ang ulo nyo po. Use your eyes only po. So, okay po. Next naman po, ma'am, can you cover your right eye po? Then, basahin nyo po yung letters na nasa harap nyo. Next naman po, yung sa kabilang eye naman po yung basahin nyo. Okay po, thank you po. Can you cover your right eye po, ma'am, and say yes if nakita nyo na po sa peripheral vision nyo po yung pen?
Yes. 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 Yes.
Cover your left eye naman po.
Yes. 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 Yes.
So next is cranial nerve number 9, which is glossopharyngeal. Cranial nerve number 10 is the vagus. So ma'am, can you open your mouth po? I'm going to test the gag reflex. Can you swallow po? Again po, ma'am. Okay po, thank you po. So, yung next naman po is cranial number 6, which is the trigeminal. So, ma'am, yung first po yung is mandibular snatch. Ma'am, can you clench your teeth po? Okay po, thank you po. Cranial nerve number 7, which is facial. So, ma'am, can you smile po? How about po frown? Whistle po. Can you show your teeth, ma'am? Pop up cheeks po. Purse lips. Raise your eyebrows. Close your eyes tightly against your chest. Okay po, thank you. So, next po is the cranial nerve number 8, which is auditory. Next naman po natin gagawin, ma'am, is yung Raynaud test and Weber test. So, first po is yung Weber test. Naririnig niyo po ba, ma'am? Ayan po. Naririnig niyo po ba both, ma'am? Okay po. So, next naman po is sa Raynaud test. Sabihin niyo po if tapos niyo na po siyang narinig. Okay po, ma'am?
Okay, ma'am.
Bye, ma. Tapos.
Next is the cranial nerve number 11, which is the accessory. So, first, assess the trapezius muscle. Next, assess the sternocleidomastoid muscle. Okay. Next is cranial number 12, which is the hypoglossal. So first, assess the strength and the mobility of the tongue. Ask the client to protrude down, move it to each side against the resistance of the tongue depressor, then put it in the mouth. So, ma, can you open your mouth and ilabas niyo po yung dila niyo po. Open wider, ma'am. Okay po, thank you po. So, next, assessment of the reflexes. First is biceps. Reflex, it tests the spinal cord C5 and C6. Kabila po. Then, triceps. Reflex, it tests the spinal cord level C7 and C6, C8. Then next is brachioregiolis reflex, which tests the spinal cord level C3 and level C6. Kabila po. So next is the assessment of the motor function. Assess gross motor and balance test. So first is walking gait. So ma'am, lakad ka po papunta doon saka pabalik sa akin. Okay po, thank you. So, next is the Romberg test. Ask the client to stand erect with arms at the side and feet together. Note any unsteadiness or swaying. Then, with the client in the same body position, ask the client to close the eyes for 20 seconds. Again, note any imbalance or swaying. It will be called negative Romberg with the stand erect with minimal swaying, eyes both open and closed, and is able to maintain upright postures and foot stance. So, can you stand straight, ma'am, and close your eyes? Okay po, thank you. Open your eyes, ma'am. Next is standing on one foot with eyes closed. So, ask the client to close the eyes and stand on the one foot and then the other stand close to the client during this test. Maintain stance for at least 5 seconds. So, ma'am, itaas niyo po yung isa niyong paa, then close your eyes. Okay po, thank you. So, next is the heel to walking or tandem walk. Ask the client to walk a straight line, placing the heel of one foot directly in front of the toes of the other foot. Maintain heel to walking along the straight line. So, ma'am, can you walk straight like this po? Straight po na. Straight, then pabalik po. Okay, thank you po. Next is toe or heel walking. Ask the client to walk several steps on the toes and to the heels. The client should be able to walk several steps on toes or heels. So, ma'am, can you walk po papunta po doon ganito po. While yung pabalik po is ganito. Okay, go ma'am. Okay po, thank you. Let's come now to the next, which is the fine motor test for the upper extremities. Next is the patellar reflex, which tests the spinal cord level L2, L3, and then L4. So next is the Achilles reflex, which tests the spinal cord level S1 and S2. Then, last is the plantar or Brain's case reflex used to determine adequacy of the central nervous system. Kabila po. So, next is fine motor test for the upper extremities. Next one is fine motor test for the upper extremities. Ma'am, tap your nose po, side to side. Okay po, close your eyes po. How about here po, ma'am? So, first is finger to nose test, then ask the client to abduct and extend the arms at shoulder height and rapidly the nose, alternately with one index finger and then the other. The client repeat the test with eyes closed if the test is performed easily. So, thank you, ma'am. Next is alternating supination and pronotion of hands on knees. Patients can supinately and promote hands at rapid pace alternately. Ma'am, can you do this, ma'am? Okay po, thank you. Next is fingers to fingers. Ask the client to spread the arms broadly at shoulder height and then bring the fingers together at the midline. First with the eyes open and then close. First slowly and then rapidly. Performs with accuracy and rapidity. So, ma'am, can you do this, ma'am? Spread your arms po. Don't. With close your eyes po. Can you do that fast, ma'am? Okay po, thank you. So, last is the fingers to thumb. Ask the client to touch each finger at one hand to the thumb of the same hand as rapidly as possible. Rapidly touches each finger to thumb with each hand. So, can you do this, ma'am? Fast po. Sa kabila naman po. Okay po, thank you. So, next, assessment of the sensory function. First is light touch sensation. So ask the client to close eyes and respond by saying yes or no whenever the client feels the cotton wisp touching the skin. With the waist pop cotton, lightly touch one specific spot and the same time spot on the other side of the body, and ask the client to point the spot where the touch was felt. So close your eyes, ma'am.
Yes. 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 Yes.
Okay, thank you, ma'am. Open your eyes po. Next is pain sensation. So, ask the client to close eyes and say sharp, dull, or don't know when the sharp or dull end of the broken tongue depressor is felt. Alternately, use the sharp and dull end to lightly prick designated anatomic areas of random, able to discriminate sharp and dull sensation. So, can you say sharp, ma'am, if ito yung na-feel nyo, and dull naman if cotton. So, can you close your eyes, ma'am?
No.
So, position kinesthetic sensation.
Down. Straight. Up. Down. Straight. Up.
Okay. So, next is the temperature sensation. Touch skin area with the test tubes filled with hot or cold water. Have the client respond by saying hot, cold, or don't. So, ma'am, can you close your eyes po?
Cold. Hot. Cold. Hot. Cold.
Okay po, thank you. So, next is fine motor test for the lower extremities. Can you, itaas baba niyo po, ma'am, yung paa niyo? So, next is heel down opposite shin. To or ball of foot to the nurse's fingers touch. So, can you touch here, ma'am? Okay po, thank you. Next, ask the client to touch forefinger with large toe of each foot. Move smoothly with coordination. Kabila naman po. Okay po. Then, the extinction phenomenon. So, simultaneously stimulate two symmetric areas of the body such as thighs, the cheeks, or the hands. Both points of stimulus are felt. So, sasabihin nyo po, ma'am, kung ano ang tinatap ko. Okay po?
Thighs. Face. Cheeks. Hands.
Okay po. So, that's all for today, ma'am. Thank you for coming today and have a good day.